This video demonstrates how this healthcare application named TWIVES works. TWIVES stands for Two-Way Interactive Video eConsult System. TWIVES was developed to enable patients, possibly assisted by a community health worker in remote and rural areas, to connect with healthcare providers at distant locations, securely and privately from their homes. Imagine a patient in rural Africa connecting with a provider volunteering from Canada. The first thing a patient does is to register in the system using a valid email. After authentication, the patient is ready to use the system. To use TWIVES, the patient enters the username and password used during registration. Then click Login. The patient will be presented with a page to select the type of consult registered for. In this case, it is a one-on-one with a provider. The patient clicks the image shown. The next page shows all the consultations the patient is signed up for, sorted by date. The patient simply clicks on the appropriate link. In the next page, the patient can choose to use a different screen name, or invite others to the video consult, depending on their access level. For this demo, the patient simply clicks on Enter Video Chat. The next page shows the video eConsult room. As shown, there are two windows, one for the provider and the other for the patient. Also, at the bottom there is a text chat feature that could be used by the patient and provider if needed. The provider's notes and recommendations from the consult can be stored for access by other providers and the patient. The entire eConsult session is recorded and stored in a secure database. Upon request, the stored information could be retrieved or exported to an electronic medical record system. Once the session is over, the provider and the patient log out of the system and the session is terminated. This concludes the demonstration. Thank you.